So now that we've understood the causative agents for cancer, what are the typical signs and symptoms for cancer, Dr. Ramesh?
To be very frank, there is no single symptom by which I can tell that this particular patient is suffering from cancer. There are no specific symptoms that will tell the doctor that it is cancer. And depending upon the organ in which the cancer develops, the symptomatology varies. If you look at thyroid gland, and if a cancer develops in the thyroid gland, because it is directly under the skin, like the breast, so the new lump that is formed can be palpated. It could be visible to the naked eye. Apart from the lump, sometimes in the breast there could be retraction of the nipple, changes in the skin. If the patient has a pathology, a disease, cancer disease in the intestine, then the symptoms are going to be that of the intestinal problems. But again, these are not specific for cancer. The symptoms could be in the form of obstruction, which presents in the form of bloating, pain, or the patient can have some vomitings or blood in stools. But we have to remember that all these symptoms could be present even in non-cancerous diseases. So it is necessary for the treating doctor to have a high level of suspicion, depending upon the duration of the symptoms, depending upon the age of the patient. The treating doctor needs to be conscious. So, to repeat myself, symptoms are not specific for cancer. The symptoms are going to be based on the organ in which is involved, and by the treating doctor having a high degree of level of suspicion. If the symptoms have not resolved by simple treatment, and if the patient falls into that age group where a cancer of that particular organ is common, then the doctor needs to take steps to investigate further and rule out cancer. Whereas in the case of patients, they should understand that there are no specific cancer symptoms, and any symptom that they are experiencing, if it is not resolving with routine treatment, they need to become cautious, get in touch with the doctor, especially an oncologist, and get investigated. I'm stressing on this point because it is very common with patients coming to me asking me, are there any specific symptoms? Is there any single test by which they can identify cancer? Unfortunately, no.